Kia ora everyone. Chris Jackson here, Medical Director from the Cancer Society, joining you all. I'm currently not in self-isolation. I'm currently at the front line at the hospital. I'm on call for oncology for the hospital at the moment. So you're currently in my office. I wanted to bring you an update as what's been happening over the course of the last couple of days since we last caught up on Facebook Live. And wanted to touch base about all the incredible things which have happened over the course of the last few weeks. I hope you guys are all safe. I hope your family are all safe. I hope your friends are all safe. And I hope the first day of full self-isolation is going okay. Currently my wife and my kids are at home. Kids are probably ripping up the place. About lunchtime yesterday they were really struggling with the first half day of self-isolation, so that was tricky. But I think it's going to be a long 4 weeks ahead, and I know many of you have got kids as well and know exactly that same feeling. So really strange times, but important for us to do this in order to make sure that we keep our vulnerable people safe. So here we are. I thought I would take you through what's going on at the hospital, then talk about some of the national responses, and then talk about some of the things which are happening with the Cancer Society nationally as well, and hopefully answer any questions that people may have about the national response or COVID and what it means for cancer people. First of all, I'm just going to show you my new desk. So this is me set up here at my desk. I've got my family photos up there and my two screens, and now the most important thing is my telephone. I do my video consultations from in here now. We've got these very ungainly headsets that we're supposed to wear when we're doing our consultations via telephone, which make me feel somewhat like a Cyberman from Doctor Who, and that's what we're doing. This morning I ran a telephone clinic and spoke to a number of patients on the phone today to check in with them with how their treatment was going, and also answer their specific questions. Also had a new patient consultation, so met with a patient for the first time purely by telephone, which is not what we're used to doing. It's nice to be there in the flesh with people to get to know them well and examine things if they need to be checked over, but that went reasonably well, and the person I spoke to today was able to be spoken through what needed to happen with their treatment as well. So that's our nerve centre. We then have any documents that we need sent off or faxed to pharmacies, and prescriptions sent off that way, and are trying to courier as many meds as we can to people. One of the things that a lot of people have been asking is my cancer treatment going to go ahead? I think it's really important to say that if you need cancer treatment, you will get cancer treatment during the course of this next 4-week lockdown. Cancer services are considered essential. So if you need a scan for your cancer, if you need surgery for your cancer because it's symptomatic, if you need radiation for your cancer or chemotherapy, you will get that treatment. Now, for some people who are on treatment for cancer, their immunities may be very heavily suppressed, and it may well be that for specific people, the treatments are changed because of their health. And that's because people who have a lot of comorbidities or other health problems and who are at risk of COVID or have been exposed to it or on immune suppressive therapies, their risks of COVID complications may be higher. And a doctor may talk with those people specifically about the idea of changing the type of treatment they're on to one which is less immune suppressive. Now that's a person-to-person discussion and decision. There is no wholesale stopping of cancer treatments just as a result of COVID. Equally, earlier in the week, there have been a couple of staffing glitches around the country. Now, with everyone going into isolation, with returning travellers going into isolation, the health workforce is huge. And so around the place, there have been people who've been overseas on holidays who've come back, who then were told to go into self-isolation, and that's reduced the number of staff in some centres, but they will come back online. So there have been a couple of places where treatments have been deferred for a couple of days because of staffing reasons, but they would be temporary, and then the treatments would be resumed. We're seeing a lot of theatres, operating theatres are currently suspended for elective operations, not for cancer surgery, but for elective operations, things like knee replacements, hip replacements, that type of thing, things that you can safely defer for a period. Now they are being wound down. A couple of reasons. Number one is to keep people out of hospital. Number two is also to train the staff in theatres and anaesthetic staff in terms of helping make sure that those staff are well trained if we need to increase the ICU and ventilatory capacity in New Zealand. So if people get COVID, we need to use more ventilators, and there are a lot of ventilators currently in theatre, so making sure people are up to date and ready to go if indeed we do have what some other countries have unfortunately seen, and that is a large number of people needing ventilators. So we have to be prepared for that. So yes, theatre activity is less. The hospital is quite eerily quiet. My team is mostly working from home, not the nurses. The angel nurses have to be here to deliver the treatments, and the radiation therapists are here. But the doctors are at home. We've all been using remote working software, having a scrum meeting every morning to touch base with each other. And we ran our first multidisciplinary cancer team meeting. We ran our very first one purely online today, which was quite a novelty, but we still managed to get through all the cases. And that's really important, because one of the things that could potentially drop off when we do physical distancing is collaborative teamwork. And actually, people with cancer need all of their specialists working together to get the best possible outcome for them. And we are really keen not to at all in any way, shape or form compromise the quality of care that people get during this time. So we've gone to online working, and that meeting went just really, really well. I was surprised at how well it went, and it was great. But less chat and banter between the doctors at the meeting, but that was perhaps okay. It helped us keep focused. What else is happening? The hospital's been limited to just 1 or 2 entrances, and now people are coming through only 1 or 2 entrances and being really strict with hand hygiene. Visitors have been almost completely prohibited from the hospital because of the physical lockdown. But for people who are visiting relatives who are nearing end of life, then there are compassionate visitations allowed. Unfortunately, not everyone is able to get home from hospital. I'm pleased that at the present time, the people who I've got with me in hospital are only going to be here for a short period, and then we'll be able to get home. Hopefully we don't end up in the situation where people approaching end of life are not able to get home to their loved ones. So that's what's been happening on the wards. The other thing that's been happening too is that, as is the case of many of you, there are people who are essential workers who have children. So many people in relationships, both people in the relationship may be essential healthcare workers, and they may have dependent children. And so that may mean that childcare has been a real problem to organise over the last couple of days. And so that's now being worked through, and we expect again our numbers of staff at work will be up again in the next couple of days. So staffing, work through that's been important, but the amount of planning has just been unprecedented. It's been just such a massive logistic exercise trying to organise a complex health system, making sure everyone's on the same page, and then working through some of the potential scenarios for what happens if healthcare workers get sick, if we start to get a COVID epidemic in the community whereby we have COVID infected patients. How do we keep cancer patients safe in that context? How do we keep people with immune suppression safe? How do we ensure our ward, inpatient ward, where the sickest patients are, how do we make sure that they are safe from infection? And if people do get infections, how do we still maintain the treatments? We've been working through all of that. We've worked through a couple of worst case scenarios as well. What should happen if our healthcare staff are decimated, which hasn't happened anywhere in the world yet. Spain's 10% down, 13% down. But nowhere near the 50% scenarios or worse that we've planned for, but we've been planning on that too. And that's been a really big exercise too. The Cancer Society has been working very hard over the course of the last week as well. Now, many divisions at the Society have shared accommodation. They have drivers with older volunteers who, under usual circumstances, would be driving people to and from treatment, but of course people who are over 70 are at increased risk and have been very much told not to go out earlier in the piece and now are confined. So we've had to work through those transport options. Now, transport options differ from region to region and they differ from hospital to hospital. So if you're concerned about getting to treatment, then you can speak to your treatment provider as well, the hospital service that's looking after you, to talk about transport options that are available, and the same with accommodation options. We know that a couple of the divisions are still looking after people as well in their current accommodation and are looking at how we repatriate people as their treatment comes to an end, and that's been important. And we also know that cancer is a very stressful time, emotionally stressful time, distressing time. People are away from their families as well, so the social isolation is increasing as well, and that will be very, very difficult for a number of people. And what's happening with that? Just looked down at some of the comments and got a bit distracted from my train of thought there. I should try and say, try and refocus what I was going to say. So we go, are we able to comment on changing treatment during the lockdown? So what's happening with changing treatment during the lockdown? Well, there is no need for whole-scale changes just because of resourcing. So resourcing is not a reason why treatments are being changed. There are some treatments which have been recommended to change. I'll give you a couple of examples. Some people have prostate cancer, and in prostate cancer, what happens if it's very advanced or you're waiting for radiotherapy is you can have a short course of hormones, a few months, and then go on to radiation therapy. But actually, there is evidence which suggests a longer course of hormones for some people is appropriate. And if we're looking at a pandemic, then perhaps keeping people on a hormone therapy for a little longer and then having radiation a month or two down the track when the epidemic is through, we know a bit more what's happening, that may be more appropriate, and that's what's happening. And indeed, there are some types of radiation that can be done in a more compacted way, so using 1 day of radiation instead of 5 in certain clinical situations is approximately similar, and sometimes using 5 days of radiation instead of 20 is similar in certain circumstances, and so those fractionation schedules could be compressed. And where we can compress, we will, because we know people are away from home for a longer period of time, and we need to make sure that we have capacity within the system in case we hit the situation where healthcare staff go down, and so we can still continue to provide life-preserving services throughout and all cancer treatments throughout. Radiation and chemotherapy appointments are still happening, absolutely are still happening, and a lot of those will be different though. They'll be happening via telephone or remote consultation. People who've got symptoms though, I mean, I have some patients who say, you know, I've got this particular new symptom and I might not be sure exactly what the nature of that symptom is, or I might need to do a physical examination to work out what it is or organise some testing. And in that situation, people are still invited to come to hospital for an examination, as would be best practice, and they'll be brought into the clinical environment for that examination and those tests. Radiology and scans are still happening around the place, so we've been working with our radiology colleagues, working through what scans should be happening, and in fact cancer scans should be happening. Again, there are some scans which we do for follow-up purposes. So one situation that I know well as a GI oncologist is follow-up scans for bowel cancer for people who are a year or two down the track after their operation. Now, it's not clear if you should do the scan at a year, at 18 months, or at 2 years. And if we're in a situation where the CT scanners are completely chocker because their staff have gone down, and we think, well, should we just pause that scan for a couple of weeks while the staff come back up, then yes, that has happened, but there is no plan to stop doing the essential scans for people's care at all. And people who need scans to work out if their cancer is responding or not, still getting the scans to work out what the best treatment is, still happening. Today at our MDT, we worked through the cases of 20 different people and recommended many different scans for those people or other tests, and they'll all still be happening. So that's all going. Someone's asking how long after cancer treatment is immunity compromised? Well, that is different between different types of treatment. There are some therapies which are deeply immune suppressing and some which are not. And some people have cancer surgery, some people do not. Some people have metastatic disease or cancer with secondaries, and some people just have localized cancer, so a small lump which is taken out. And as you can imagine, the degree of immune suppression is different in those different scenarios. So people who have had, say, a small lump taken out of their breast, their immunity would only be very minimally compromised. People who are on hormone therapies for breast cancer, again, very limited impact on the immune system. Common treatments like Keytruda, again, small impacts on the immune system. Whereas blood cancer treatments or bone marrow transplants are very deeply immune suppressing. There are some situations too where the blood doctors tell me that bone marrow transplantation may be deferred because of COVID. And that's because if they deeply immune suppress someone and take away all of their immunity, and then we get a wave of infection, then that infection could be lethal. And so in that situation, the blood doctors have recommended it's clinically the right thing to do to defer the transplant for a period and use some treatments down the way. Yeah, so the Cancer Society is moving a lot of its supportive care online. So in the same way that I'm talking with people via telephone or via video conference call at the moment, the Cancer Society is setting up its counselling services to go online, and is also looking at how it might be able to run its support groups online as well. The 0800 Cancer line is still working, and that's an important source of information and reassurance for many people out there who's there. Someone else is asking if chemo is being used to prolong life rather than cure it, will it still go ahead? Well, yes, we have not been told at all that we have to stop life-prolonging chemotherapy. I have some patients who've been on chemo for a year, 18 months, 2 years, and if they're very stable and they're worried about coming to and from hospital, then having a chemo holiday is sometimes a good idea, because the risks and benefits may change. But we're not restricted from giving it, and if it's in the best interests of the person to stay on chemo, then absolutely people will be able to stay on chemo if that's the right thing to do for them. Yeah, so 0800 Cancer, supportive care online, a number of changes happening to the structure of services and the way in which we deliver it, but people still able to get the treatments they need, and if you need cancer treatment, you will still absolutely and utterly be able to get it. So what I'm going to do is I'm just going to take you and just show you very quickly as we scoot around. It's not just me here. We've also got my colleague Tiv. This is Tiv. You can see Tiv there. Oh, here we go. G'day, this is Tiv. He's working on a radiation plan at the moment. I better not show too much because there may well be some patient information in there.
Colouring in as usual.
But Tiv is a radiation oncologist here, and he's still planning radiotherapy for the patients who need radiotherapy during this time as well. So people still getting the essential life prolonging and curative radiotherapy that's needed, and treatments that need to happen to improve people's pain control or other symptoms are still going ahead. You can see Tiv's working hard, and unlike me, he's still in shirt and tie, and so he's making sure that the oncology dress standards don't go down during this time either.
Thanks for the plug.
So, yeah. All right, so radiation oncology going ahead as normal as well. Okay, so I hope you guys are doing okay. Really nice to connect with you all electronically. Thank you for all your questions that have come through as well during the time. Don't forget to like our page, put any questions you've got on there, and keep the questions coming to the 0800 number. Now, a lot of those questions have been coming to me as well, and I must say I've been pretty swamped with work over the last couple of days, both catching up with patients and also planning for the response and working with the Society to make sure the vital work of the Cancer Society carries on. And so I've been a little slow on that. I apologise, and I'll hopefully finish that off this afternoon. So you guys take good care, look after your families, look after yourselves. Make sure you still get a little bit of solitary exercise during the course of the next wee while, because we all know that exercise is good for you and helps reduce the rates of cancer recurrence and helps you feel better and live better. And make sure you keep your kids off the playgrounds and so on, and you keep safe during this time. We'll look forward to staying in touch, updating with things as they go along. Hopefully we'll stay COVID-free in terms of ICUs and important cases, people getting very sick with that. Hope everyone who does have COVID recovers quickly and that it doesn't progress at all. And we hope the workers out there stay safe too. Thank you to everybody, the frontline workers who've put themselves at risk over the last wee while, the admin staff, the front of house staff, drivers out there who've been engaging with people as well, the kitchen staff to keep the cafeterias open, the supportive care workers out there who've been looking after people as well, the wonderful nurses, radiation therapists out there as well, and lucky old doctors who get to do a lot of their work from home. I think we've got it easy compared to the other wonderful frontline staff. So you guys take good care, be well, be kind to each other, and look forward to connecting again in the next wee while through perhaps another Facebook Live post. Take care, ka kite anō.